What should you expect after weight loss surgery? Joining us is Dr. Mark Takata. He specializes in minimally invasive bariatric surgery, weight loss surgery at Scripps Clinic in La Jolla, California. Thanks so much for being with us, Dr. Takata.
Thank you. Nice to be here.
What are the long-term side effects of bariatric surgery?
Patients after a sleeve gastrectomy can feel a little bit of heartburn, for which they might need some medication to help control. After gastric bypass, patients can feel a little bit of gassiness or bloating at times. But for the most part, there really aren't many significant long-term side effects. We do strongly recommend and almost require that patients take vitamins after surgery, and we educate patients about that. We also monitor their vitamin levels with regular blood work after surgery. So with careful monitoring, there's very minimal as far as long-term problems that you can see.
And why do you need to monitor those vitamin levels?
Some of the vitamin levels, if they go low or possibly even too high, can have some clinical side effects. So we just want to make sure things are staying in the relatively normal range.
And how do you manage your weight after a bariatric surgery? What should you be eating and not eating?
So, some of the same tenets of weight maintenance and weight loss still hold true. Patients need to stay compliant by avoiding a diet high in carbohydrates and high in sugar. There should be a little bit more focus on protein as well as fiber. And exercise is a strong component to weight maintenance in the long term. I find that the patients that are most organized with their diet and with their exercise regimen tend to be the most successful in the long term.
So you have the weight loss surgery, you reduce the size of the stomach, the fat's gone, but one of the side effects of it is a lot of loose skin, correct?
It does depend a little bit on the individual. It depends on their age when they first have the weight loss surgery. It does depend a little bit on how much weight they lose. So patients who are 150 or 200 pounds overweight will clearly have more excess skin than people who just need to lose about 70 or 80 pounds. And some of it's just individual as far as how they look at it. Some people are not bothered by it too much at all. Other people they see it as somewhat of a detriment. But individually, people make decisions about what they want to do with it. Obviously, exercise and staying in shape will have a positive impact on that.
And what about surgery, though, to remove that loose skin?
Right. So there is the option for, it's called plastic surgery or cosmetic surgery to remove some excess skin. In some cases, plastic surgery will be medically indicated because if some of the excess skin is causing skin irritation or rashes or wound issues, it could be medically indicated. In other cases, it could be purely cosmetic, but that is an option for patients.
And how long should you wait after you've had the weight loss surgery before you have the surgery to get rid of that saggy skin?
In general, we want patients to wait at least a year to year and a half to 2 years before they start exploring that. And plastic surgeons will generally want to see weight stabilization over about 6 months or a year before they start pursuing excess skin removal. But that'll be a discussion they have with their plastic surgeon.
So why do you want them to wait that long?
Mainly to get down to the weight that they want to get to, which could take about a year, and then to show some stabilization of their weight to make sure weight is not coming back, or maybe they're not losing too much weight, just to make sure from a health standpoint they're doing well.
And then what does that surgery involve in terms of getting rid of the loose skin?
It generally involves making incisions to remove the excess skin and some of the subcutaneous fatty tissue. It depends on what part of the body we're talking about, but it does require a general anesthetic to do the operation. But usually it's an outpatient operation with a reasonable recovery time.
So how do you manage your weight after bariatric surgery? I mean, you mentioned it before, exercising. How soon can these folks exercise after surgery, and what kind of exercise are you talking about?
In the first 4 to 6 weeks, we want patients to start walking and to advance the time and length that they're walking right away. After about 6 weeks, there's really no restriction at all to physical activity. We have patients who do kettlebell competitions, races, surfing, swimming, weightlifting type sports. So there's really no restriction at all to physical activity. And we encourage that as part of their weight maintenance program.
Dr. Takata, thanks so much. We really appreciate you taking the time to be with us.
Thank you very much, Susan.
If you want more information about bariatric surgery, what to do following bariatric surgery, please click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. I'm Susan Taylor. Thanks so much for joining us.